Hello and welcome to SimCast, the Higher Education Simulation Podcast. My name's Lawrence Hill and I chair the simulation group here in the School of Health Sciences at UEA Norwich.
Hello everyone, my name is Tony Jeremy and I'm the academic lead for simulation-based education at UEA Norwich.
Today we are joined by Nathan Conradie. Nathan, a very warm welcome to SimCast. Thank you for joining us.
Thanks for joining us, Nathan.
Thank you very much and thank you for having me on.
Absolute pleasure. So Nathan is a paramedic and ECP originally based in South Africa, but he's a simulation entrepreneur. Having worked in the provincial ambulance service in South Africa, where he contributed to the development of a clinical governance system from scratch, he moved to the UAE post-pandemic and has worked as an academic lecturer there for about 4 years. Within the last year, which is what we're going to talk about today, he's been developing an online platform that focuses on the maintenance of clinical currency. So we're looking forward to hearing all about that later in the episode, Nathan.
If you enjoyed the episode, please give us a like. Equally so, if you didn't like the episode, give us a dislike, but let us know in the comments why, because we're always keen to improve. To keep up to date with all things Sim, subscribe to the channel and don't forget to check the notification bell. And SimCast is available on all popular streaming platforms.
Fantastic. So we've got a lot to get into today, this platform that you've devised. But before we get into that, Nathan, could you tell us just a little bit about why you do this? Why do you do what you do?
Yeah, thank you. So, as you said a bit in your intro, I was a paramedic and then also as a clinician for a long time. And then I moved to being an academic. And I had really contrasting experiences in South Africa with my students. And when I moved to the UAE, over time, I found that the students just weren't quite prepared like they should be for the clinical environment. And I always think as an academic, especially in medicine, we have a responsibility to our students, but we also have a responsibility to the patients that they are going to treat.
Huge responsibility.
So that's where I kind of came from. And I realized that my students just weren't prepared like they should be. And there's a whole bunch of reasons why. The UAE schooling system is different. The motivations of the students are different. Just a completely different environment. So I was working on a research project to try and fix this issue that I found, that by the time the students were, or what I felt by the time the students were getting to fourth year, they just weren't ready for the clinical environment. So I developed a system where we would track their skills. And one of the other issues coming from the system in the UAE, the education system, is that it was quite similar to the American system, where you can pick and choose your modules and you go through the course as you kind of choose these. We call them courses here in South Africa, we call them modules.
Yeah.
But you can kind of choose your way through the course. So sometimes you might do a clinically focused course, and then a semester might go by and you do all of the courses that were related to Islamic studies and English proficiency and all those other nice courses that we have that makes a student a rounded individual professional by the time they come out of university. But they just weren't ready, so we couldn't always track when they were doing their clinical.
Sure.
Okay.
So there's a risk, courses. I guess, at that stage that you're through the selection of modules that are interesting and that contribute to you being a rounded person, that you maybe miss core content of a program.
When you've got professional standards and regulations and competencies that need to be achieved.
Right.
Yeah, and I think it's just the order in which things take place. So in South Africa, if we failed one of our modules, we would repeat the whole year. So we had first year students, second year, third and fourth year students. The students really went through the process or went through the degree in a very structured way.
Yeah.
Whereas in the UAE, the students weren't following that same structure.
Okay.
So from that, I realized that we don't actually know when the students did the skills that they should, throughout the course of their studies. And the feature that I brought into the application was the skills tracking side.
Okay.
So getting an understanding of where the currency is. When last did that student perform that skill or go on to shift and go on the clinical placement and actually do it on a patient?
Sure.
Yeah. And I think that's really valuable because we have like an electronic practice assessment document for our students, and it says that sometimes that they've achieved a skill, but the currency thing of how valid is it, how up to date is it, when did you last do that, I think is really important for a lot of skills.
And exactly, every single skill that you obtain throughout your studies and when you start practicing actually decay over time. So you're always going to be trying to catch up on the skill currency. So it was a valuable tool for the students, but I also found that, that can easily translate to practitioners.
Yeah.
Because everyone's skills are just going down all the time, getting worse and worse and worse if you don't practice a certain skill. So that was kind of the origin of the skill tracking side. And then what do you do when you find that the person's skill currency has dropped?
Right.
What kind of educational activity can we bring in to ensure that they are current?
Because a platform like that's going to detect latent problems that you perhaps didn't know you had. And then once you know you've got a deficit or a significant degree of skill fade, I guess if you're finding that challenge or problem, you kind of have a responsibility to then do something about it. So how does that bit work then? So if you can think about it in your own practice, you will be doing certain skills at higher frequencies. So, for example, when I was working as a paramedic, I was doing an IV line every day. Right.
I was intubating. I was working in South Africa, so we were doing a lot of high-risk patients or very sick patients. So I might intubate every week. So those skills I became very proficient at, and my currency was up, and I was, you're confident and you do it well. But if I had to pace a patient, or I have to put in a cric, or I had to do one of those other skills that we rarely perform, I wouldn't feel as confident. So that's what the gap that we try and bridge with the application is, that how do you have all of these skills? I think according to my scope of practice in South Africa, it's about 90 skills or so.
Okay.
So how do you bridge that gap between the fact that we don't perform all of these skills at the same frequency and a lot of those skills that we don't perform frequently are actually high risk?
Yeah. And more complicated. Yeah, absolutely.
Yeah.
Absolutely.
Right.
So that's what we try and bridge. That's what you try and get to with the app.
Yeah, it's a fascinating concept, because I wonder how it would look, in a UK context as well, because it's the same situation, different scope of practice, but there will be things that you do frequently. And actually, do you know sometimes when the last time you performed something is? And, do you have so it sounds like what the app can offer is that kind of not just some intervention, and we'll get into that, but also a kind of a point of reference to say, do you know, it's been 2.5 years since I did X.
Yeah, it's a skills passport or a CV almost, isn't it? With up to date. Yeah.
So tell us about the app itself then. So tell us, so firstly, it's an app, right? It's a digital platform. Tell us a bit more about it then. So yeah, explain it to us.
So the way that you can access the app or the platform is that you can access it on your phone, or you can go on the website. So there's the different versions that you can access it from. And basically you'll see when you log into the app, you'll have a skill currency score. So this is an average of all of your skills currencies.
Okay.
And then if you go into the skill module, you will see all of the skills related to your scope of practice. So when you log into the platform, you will get to choose which scope of practice you want to register with and register with the app with. And then that will bring up automatically all of the skills that are related to that scope of practice.
So you talk about currency. Does each skill have a value within that currency, depending on sort of degree of difficulty or how frequently you're likely to encounter them?
So there's two ways that you can increase your skill currency. Either you perform the skill on a patient,
Yeah.
or you perform the skill, or you do an activity related to the skill. So either way is going to track your skill. Either method of increasing your currency is going to track your currency, and you're going to go up to 100% after you perform that activity or on the patient.
Okay.
And then over time, that skill percentage from 100 goes down. And then at a point of 50%, the app will alert you to say, hey, do you want to increase your currency? Here's an activity to do.
And so we're talking about this at the moment very much from like a kind of clinician user interface, but presumably there's also some, because you know your background in clinical governance, presumably there's some kind of organizational interface option as well, where it is an assumption, so perhaps there is not, but that allows at an organizational level for you to see what all of your paramedics, nurses, ODPs, midwives
I'm thinking
are doing.
from an educational point of view, how does that then kind of feed into our audit system to keep track from an educational standpoint?
Is that part of the design at the moment, or what?
Yeah.
How does that work? So tell us a bit more about that.
So there's two, I would say, types of users of the app. We have an individual user that would be, say, someone that is really interested in keeping themselves updated, wants to get these types of activities, wants to track their skills. We are bringing on a new feature where you can print out your skills, so you can supply those skills to, say, a regulator, or you can give your skills to a university if you're a student. So it gives you, as you said, like a portfolio of all of the skills that you've done. So that's your kind of individual user. And then we work with businesses and organizations, services, and we go to them and we say, we can integrate this platform into your current clinical governance service and or your current clinical governance system. And we track their staff's skills. So when the organization logs in, their skills are already automatically uploaded through their systems, through their databases. And then we also have access for the managers to have a look at their staff's currency.
So they get like a
so
dashboard.
They can get an idea.
They get like a
Exactly,
dashboard
they've got a
view, and they
dashboard,
can
yeah.
see, I can see this staff group or this particular person is, right on top of it, but these people are in need of some refresher training. And you mentioned that the activities can be either kind of patient-facing activities, but you also mentioned simulation in there too. So what or other learning activities. So what can users of the app do to refresh their skills? And do you consider in the app the non-clinical, non-patient-facing activities to be as valid for keeping your currency up to date?
Yeah, absolutely. And so this is where we integrate within their clinical governance system. So most organizations, we work with the smaller services, ambulance service with 10, 15 staff members, right all the way to hospital systems where they've got different levels of clinical governance systems, and then also different levels of clinical education that are complementing that clinical governance system. So what we do is we work with the organization, and the idea is the content on the app is there to refresh theoretical knowledge. If you wanted to, say, do an OSCE again, refresh yourself about how to do an OSCE of a specific skill, you can go on there and get that kind of content from the app. But that will only take you so far.
Yeah.
We actually want to be able to do that skill or perform that skill in a simulated environment in order to increase your currency. So the way that the way the activities work is they become more cognitively complex. So the first time you do a skill, you miss your window. I would say you miss your window in order to perform that skill on a patient. Your currency score will drop. The application will notify you and say, hey, you haven't done this in a while. Here's an activity to update yourself. You go and you update yourself. But now you've actually only got the theoretical knowledge about the skill.
Mm-hmm.
The next time it becomes more complicated. So, for example, you might have a YouTube video, a 5-minute YouTube video. You might have a small algorithm or an OSCE sheet as your first activity.
Mm-hmm.
The second time, I'll use the example of an IV line. The IV line, how to run the IV line, if you how to administer the angle of the bevel, how you need to put it in, all those kind of things. And then the next time, the next activity will be, what are the dangers of overhydration?
Okay.
So, and then the third one is usually go into the lab and actually perform that on a mannequin in a simulated environment.
So it's almost like the modalities of simulation. Like we discuss, theory, skills and isolation, skills and drills, full blown simulation, real life practice on patients. I really like that, and I like the idea of being able to just have those push notifications coming through, like, hey, it's been a while since you've run through an IV line. You need to brush up your skills.
Yeah.
I also really like the idea of that portfolio being transferable. So certainly for our students, they spend 3 years of their undergraduate program doing this practice assessment document that then just doesn't go anywhere. It doesn't continue with the professional development. It kind of just gets forgotten about as that's what I needed to do with my degree, rather than look at all these skill sets you can then take into your employer. And it sounds like the app kind of solves that problem.
And I think that's exactly what I found throughout this journey of creating this platform, is that as I've spoken to people in the field and the industry, I've kind of changed my view of what I think needs to be, the app needs to do.
Mm-hmm.
So I found that a lot of people are saying, yes, I really like the skills tracking, but I want to be able to prove this to someone else.
Sure,
I want to be able to take it to a regulator.
Yeah.
Or I've got students now that want to say, can I upload my skills onto the platform? And then I take that to my lecturers, instead of filling out a manual form and recording it some other time later.
Yeah,
and also like a potential employer,
and
a potential employer as well, because these
Exactly.
grads are competing for places in employment. Certainly here in the UK, there's a the job market for graduate paramedics is getting really tough. So being able to provide some evidence of these are the psychomotor competencies, these are the skills that I've done. And the other thing that occurred to me while you were talking was, yes, there's keeping myself up to date clinically so that I'm competent and safe. And yes, there's the clinical governance side of things. At an organizational level, we can say that our staff group are, this percentage competent or current, sorry. But the other thing is actually as an individual to kind of have that reassurance of, I am feeling a bit rusty, and the data backs that up, or actually, do you know what? No, I am current. You have a crisis of confidence or whatever. So I think there's a real sort of psycho-emotional component to sort of having that live database.
I think this would be great for educators as well, particularly when you're a healthcare-based educator and you step out of clinical practice. There's always that, I feel a bit rusty, am I clinically competent? So having an app to sort of go, you're up to speed with things, I think is useful. The usefulness is really, really important. If you're from the UK and you're sort of a certain age, around kind of our age, you'll remember when we were at high school, we were given this thing called a National Record of Achievement, this maroon folder that you were told is the most important document that would follow you throughout your life.
I've still got mine. Have you still got yours?
Yeah.
Yeah.
No one ever looks at it. It's just the most pointless piece of documentation. So it's got to be useful at the sort of point of contact, hasn't it?
Yeah.
And I mean, going on, I've also found that we operate. I'm from, obviously from the UAE, so a lot of my customers are here within the Middle East. And what we've found is that they are hiring all over the world. So they are hiring guys from the UK, from Bangladesh, from Pakistan, South Africa.
Yeah.
So when those practitioners arrive, how current are they? They've come from different education. They've had vastly different experiences. So when they come to the actually needing to perform the job, are they ready to do that? And that's what the app helps with.
Sure, a standardization process and ensuring people are on a similar level. So yeah, I can see the use. So which professional disciplines are you focusing on at the moment? Because clearly, the whole of medicine, the whole of nursing, the whole of midwifery, massive, you've got not an infinite number, but a great number of professions that you could be looking at. Where's the focus of attention at the moment?
So the focus now is on the emergency medical side.
Okay.
But in the next very short while, we are opening it up to a whole bunch of other professions. So it's a bit tricky because we have to match the scope of practice from around the world.
Yeah, that's always the challenge with something like this, and you want to diversify, isn't it? You have to meet those proficiencies.
Yeah, and as we go to organization, we say to them, what kind of scope of practice do you want? And they can load on a specific scope that they want. If there's something that they say want to be included. I mean, the other challenges, we come from I'm talking about the EMS side, a very structured system of scope of practice. If you look at nurses, a nurse might qualify as a registered nurse or enrolled nurse, but they go into an environment that they might be working in a cardiac unit, or they might be working in a whole bunch of other places. It might be in the emergency department,
or end of life care, or in a mental health unit, or in a huge diversity of potential areas.
I guess the advantage of you being an entrepreneur rather than a large kind of faceless business is you can go to these individuals and provide a more sort of bespoke plan of how you then evolve it.
So I think that's exactly what you need to do. You need to evolve with what the field and the industry wants. So throughout my kind of journey from, starting this to kind of now, I've really had to listen to what the industry wants.
Yeah.
And I've tried to really incorporate that into what the platform can do, and especially all the features that are going to come in the future. We are really trying to meet the needs of what the practitioners need and what students need going forward. So it's exciting.
So we'll probably talk about the future in a moment, but I guess what I'd like to know from you, Nathan, is what have you learned along this journey from taking this idea and concept to making it sort of practically usable? There must have been some challenges along the way.
Yeah, I think it's been a really interesting journey, and I think in the last year I've definitely grown, a lot as a person, because I was a clinician. So my patients are customers, but they're not customers in the traditional sense where you have to convince someone of something. And my students are practitioners, are customers, but they're not. There's a different relationship. They're more customers than the patients are. And now you go into a world where you have to, try and convince someone of your idea. And I kind of, at the beginning of the journey, just thought that the platform would kind of speak for itself. And as a healthcare provider, I'm very patient, outcome focused, because we always think in terms of what this can do for our patients. How can this improve our patients' outcomes? How can this make our treatment more efficient? But then when you're trying to convince an organization of, taking on a platform or paying you a certain, paying for a service, you have to really have that. You have to focus that pitch in a different way.
Sure.
So that's something that I've learned, and then a whole bunch of other things that, you know, when you're starting out, you have to do a lot of things that you hadn't done before.
Yeah.
So, I mean, you need to learn about marketing, you need to learn about accounting, you need to learn about a whole bunch of other things, video editing. You know,
Yeah, we were saying before, weren't we? Lighting
content.
and things, all of these kind of things. Yeah.
Yeah.
But it's so
So
nice
that's
though.
stuff that I'd never known before.
It's so nice to hear because it's actually, you know, simulation-based education as a vehicle for entrepreneurship, bringing you into a completely different realm, but using some of the skills that you've had from using many of the skills that you had as a clinician, but having to learn a whole host more.
And I think
it's just great to hear that the simulation is providing those opportunities for people to grow.
And I think simulation is in a boom period at the minute with you know what we can do with technology, apps, AI, what I guess you call the old school technology of the patient mannequins and stuff. They're continually evolving as well, but it's much, much bigger than that. So to see these kind of initiatives where you're using an aspect of that, but using new ways to take an old concept, which is just keeping up to date and keeping track of things, but making it much more accessible and usable is, it's fantastic.
Bringing keeping up to date.
Yeah.
Yeah. So yeah, exciting times, and it's been great to hear about the journey to thus far and where it's at. But what about the future? What are the next steps for you, Nathan?
Can you tell us? Or
can you tell us?
Is it all under wraps?
No, I think there is a way that the app is going to evolve and the platform is going to evolve. So we are moving away from. We're always including different features into our application. So what we're going to be doing over the next 2 months is we're really going to be focusing on the student population and bringing out ways of extracting the data from our current platform. And, you know, this also gets, you know, we need to get the universities involved. We need to, you know, get them to accept that the students are going to be recording their skills in this way. So that's another way. And then we're also bringing out CPD activities and way that, you know, you can create CPD activities and put those on the platform.
Right.
And there is some stuff that even in the future that we've got earmarked, as well as, so the hiring process, for example. So we're bringing on a way that the hiring process is going to be managed through the application, and so that by the time you start at your job, you actually have a certificate to say that this is what you're going to be expected, or this is your current currency. So
wow.
It's exciting to bring on these different features and to constantly evolve. And I think one of the advantage of really starting out not as this kind of massive organization with this huge big budget is that I've just gone out to the industry and really spoken to people and get a sense of what they want. So, you know, in terms of, I've got a short-term plan, long-term plan, where I want to see it going in the future. But I'd just like to see the platform in, you know, as many people's hands as possible. You know, and again, we always think of it in terms of, and as healthcare providers, as in terms of patient outcomes. That's where our focus is. And if people can use the platform in order to keep themselves updated and can treat their patients better, you know, that's really what I want to see.
Fantastic. What piece of advice would you give to anyone else who's perhaps in a similar situation to you? They've got this idea, they can see a need for things, and maybe they've kind of had a background of safety, but they want to take that leap into entrepreneurship. What would your advice be?
Well, I mean, I've got people that advise me, so I don't know if I'm the right person to give a lot of advice.
But you've done it. You've taken that leap. So
I think what I can speak from my journey, and I think what I've done, and this is going back to the advice, is that I've really tried to lean on people that have done this before. You know, my whole, even just putting together a business plan. So I'm very fortunate to have an uncle that I worked in startups for a long time. He's retired now, but every time I've got a question, I go to him and say, you know, I've got this, should I do this?
Yeah.
You know, and he helps me out with that. So I think you're not alone in your journey. Everyone has got someone that has, you know, knows an accountant or knows someone that started a business by themselves. So everyone's got that kind of network that you can rely on. So I say that has been really, really valuable for me. And the other thing is that you have to, if you're going to do it, you have to commit yourself 100%.
Yeah.
Because if you try and do a job and something on the side, you're always going to be out-competed or out-performed by someone that is spending all of their time doing that.
Yeah, that's a great point.
So I think, you know, you really need to, if you're going to do something, you know, do it properly. And I did a lot of planning before coming up to that point. And I think there's a lot of things that you can know, and there's a lot of things that you're not going to know.
Sure.
And it's not possible for you to know, or you can't research your way out of getting there.
No, sure.
So I think that's part of my journey, and that's what I've done well in some ways, and then in other ways, when the challenges come and you know, some things don't go well with the client, or they don't turn out the way that they should, you just kind of move on to the next thing and focus on, you know, your overall vision for what's to come.
And I think that vision is strong. And if people have heard, you know, what we've talked about today, and they're curious, they want to know more, or they can see an opportunity within their organization, their higher education institution, their business for something like what you're doing, how do they get in touch with you, Nathan?
Yeah, so we're on LinkedIn. We've got a page. So if you just type in Proficien, you will get, it's like proficiency without the C and the Y at the end. So you can type that in and you can get
Proficien.
our LinkedIn page.
Did you say
Proficien? Yeah.
Proficien. Oh, nice.
Proficien, yeah. And then you can look us up on our website. It's proficient.org. And you can get in contact with us through LinkedIn, Instagram. And we've got a YouTube account. So yeah, that's basically the way that you can get through to us.
What we'll do is we'll do our best to put all those links in with the video on YouTube, so that we can help people connect with you.
Perfect. Thank you. I appreciate that.
Nathan Conradie, thank you so much for joining us on SimCast today. It's been really interesting to hear about your business and your background and the plans for the future. It's been great. Thank you so much.
Thank you. And guys, I just wanted to say before we end off, what a great job you guys are doing. It's not easy to put out content like this. It's not easy to do the editing. I've had a little bit of experience with it now, and I think what you guys are doing, giving people the opportunity to speak out there and get their message out there, I think it's really good. So
thank you.
I want to congratulate you guys for
thanks, Nathan.
50-something episodes.
No, appreciate it. And listening to you talking about some of the challenges and the hurdles you've been along your journey, we've definitely felt that as well. Yeah. So it is a learning process, but it's made so much easier when you love what you do, and we definitely love doing this.
100%. So. Yeah, well, we hope you've loved this episode actually as well. So big thanks to you for listening, because this podcast wouldn't be what it is without the people that listen along to it, and fantastic guests like Nathan Conradie. So thank you very much for listening, and we'll see you on the next one.
Thanks, everyone. Bye-bye.